All right, today we are talking all things lumbar spine. So what is our lumbar spine? Our lumbar spine is the bottom of our back. We've got 5 lumbar vertebrae. 5, 4, 3, 2, 1. That's number 5, that's number 4, that's number 3, that's number 2, and that's L1. They're the bones. So the bones are the vertebrae that sit nice and stacked, nice and heavy, nice and stable to support the weight of our upper body and our head. These bits in between are what's called our intervertebral discs. So if you ever heard of a disc injury, it would be to something in this region. This person has a bit of a poor description of a lumbar disc prolapse, but we can ignore that. This person's not actually injured. Then at the back, we've also got our sacroiliac joints. So our hips or our pelvic bones interact with our sacrum or our tailbone right at the bottom of our lumbar spine. So our last lumbar vertebrae, that L5 that we spoke about before, interacts with our sacrum. That's our L5-S1 joint, just in there. And then we've got our sacroiliac joints themselves on the left and the right, in there. So it's a really stable joint and doesn't move a great deal except potentially during pregnancy. The other thing that you can see really clearly on this model are these little yellow tabs. What those little yellow tabs are our spinal nerves. Sometimes you can get pain down your legs or pain into your hips, and the spinal nerves can be the cause of those aches and pains. Now that you know a little bit more about your spine, hopefully you can better understand if you do get an injury in the area. These things are A, fixable, but you also know where it's coming from. You're welcome.